Hello to everybody and welcome to this new clinical webinar of the NIRVANA system. I'm Federica Izzi, bioengineer and product manager of BTS company. During this webinar, we will talk about the clinical experience of using the NIRVANA system at the pediatric hospital Robănescu, placed in Bucharest, in Romania. In particular, I'd like to thank a lot the Dr. Liliana Padure. She's the director of the rehabilitation clinic of the Robănescu Hospital, and she has prepared this presentation and gave us the possibility to share with you today their clinical experience. I'd like to introduce also Anca, who is our precious local partner in Romania. And she's going to illustrate the presentation due to the English speaking. And the Dr. Padure will be close, of course, and be able for the question section that we will do at the end of the presentation. So thank you very much to be here with us today, and you can start the presentation.
Okay, thank you, and hello to everyone. I will try to and hopefully do my best to be the English voice of Dr. Liliana Padure. And I will start in saying a few words about the center, which is a unique structure in Romania, because they are part of creating the strategy of rehabilitation for the children with motor deficits. The clinic has 140 beds for inpatients and also 5 beds for outpatients. And the medical team consists of 11 physicians, 4 of them rehabilitation physicians, 2 neurologists, 1 orthopedic doctor, 1 pediatric doctor, 1 intensive care physician, 1 psychiatrist, and 1 epidemiologist. And also they have, I think, a team of 55, if I'm not wrong, PTs. Yes. 55 PTs.
For psychologists.
And another for
ergotherapist.
Okay, so it's a big
occupational
therapist. Okay. The center has been using NIRVANA since 2015. There are 2 systems basically installed and functioning now in the center, and NIRVANA offers to the patients a multisensorial stimulation by creating a scene with different types of virtual realities provided through the floor or wall projections, and all of this together with sound and the movement sensation. Basically, the patients are like immersed in virtual reality. The infrared camera of the system detects the patient movements and provides the feedback with no other additional equipment attached on the patient. And using this visual and auditory feedback for each performed movement, basically it's creating the real sensation of the movement in space and with the real objects. So for the hospital, the opening of such multisensorial stimulation therapy represented a true benefit for the listed patient, because they were just used until that point to the physiotherapy table and with the physiotherapists. So with the help of NIRVANA, as you can see also in the video, we managed to interact with the little patient even from the age of an infant, so very, very little. He's attracted by the colorful images and which are in motion, and this stimulates them to perform the movement by themselves, or sometimes with the help also of the therapists. So what the center and the staff saw, that the kids managed to perform movements which during a usual physiotherapy session they wouldn't be able to do, because some sort of complicity occurs in this game between the virtual image and the physiotherapist who approaches the child in the setting of virtual reality. So basically a body-to-body closeness. The main pathologies that we use the system for are the neurological conditions such as global development delay, cerebral palsy, sequelae after meningoencephalitis, or brain tumor ablation, traumatic brain injury, spinal cord injury, but also for the orthopedic impairments, orthopedic condition caused by sprains, fractures, stiffness, or spine deviation, and also genetic condition like Down syndrome or autism. This is a new, let's say, direction in which the center would like to do more research, let's say, and test, because they didn't have a lot of patients with autism. They had 2 or 3, but the results were promising, not only from the development from the motor point of view, but also from the psychology point of view. This is how it looks like for our patients. So the motor age and the number of children per week who have treatment with NIRVANA in the center. So basically from infants from 4 to 6 months, when they achieve the neuromotor possibility to crawl, we have around 7 children per week. From 8 to 10 months, when they achieve to all on 4 limbs posture, with around 15 children per week, and from 10 months and above to 18 years, each with the above mentioned pathology, around 13 children per week. We have an yearly number of 1,680 patients. So for the little ones between 4 and 6 months, when the infant achieves the ventral decubitus position with support on his forearms, and when he is able to realize something is in motion in front of him or besides him or with him moving on the floor, like today, tomorrow, he starts to extend his elbow and to roll over, and then also depending to the game to crawl. So the physiotherapists noted that the movement acquisition and its performance is faster because the stimulation is multisensorial. He sees the image, the attention is enhanced, he hears noises. Also, it's a tactile sensation because most of the time the physiotherapist is involved with his grip or corporal touch, and all these stimuli enable the patient to roll over faster and to start crawling. For the kids in the group age of 6 to 10 months, after acquiring the sitting posture and all on all 4 limbs posture and go on knees, for them we are focusing on stimulating the children to go on all 4 limbs and on their knees. For the last group of over 10 months, after they were able to stand or to make the first steps, we work on the consolidation of these phases, and there is a focus on coordination, balance, motion control, attention, and development. So basically, we saw that for the little ones, 4 and 6 months, 3 out of 7 make progresses in form of acquisition, and this is happening faster in time after the 3rd session of exercises compared to those who benefit only from physiotherapy. It is true that also a part of the patients cannot bear NIRVANA because of their fear of darkness or the difficulty to accept certain posture. but they are slowly introduced, and they can see from outside, and sometimes they are encouraged to, and they accept it. For the second group, we had positive results in 5-6 children out of 10, compared to the one who have just classic physiotherapy. And more the more the age grows, also the better results. So 7-8 out of 10 kids over 10 months gave significant positive results. So we have the following therapeutic objectives. So the improvement of motor performance, neurological and psychomotor acquisition, increase of the joint amplitude, perfecting the manual abilities, improvement of ocular manual coordination, improvement of the balance in standing and in walking posture, improvement of the child's emotional state, and increase of the child's workload, as well as the increase of the patient's possibility to get used with the therapist and with the procedure. It can be harder and so more difficult in time. It also we want to increase the life quality in the sum of all the above mentioned, because the child is more prepared for the foreign environment after trying this. These objectives of the multisensorial stimulation therapy are determined according to the patient's pathology and with its motor deficits upon the child's life. Motor assessment, therefore, establishment of both chronological and motor age, visual and auditive sensor in proper state, and child's acceptance in relation to the game environment, the semi-dark and apparently limited space visibility, and of course the patient cooperation. You can see here another video of a child around 10 months or 11 months. 11 months. So in children in which the NIRVANA therapy was indicated, during the classical session, it is observed that after the NIRVANA, there is a progress in movement control and coordination, head, body, and arms. And this occurs after a few sessions of therapy. Of course, they are always combined, NIRVANA and classical physiotherapy.
Ia uite aici. Vino aici, Tudor, ia uite. Hai, Tudor, vii la asta.
So after the first session, they are eager to come back, and also sometimes it is used as a reward after the classical physiotherapy session. As I said. So for our procedure for infants is performed with the following steps. The mother brings the infant upon the physician's indication in the room where the physiotherapist takes over and observes the motor potential, the motor age of the child. Together with the mother, if there are any preferences of the color or different games, a sensory motor stimulation plan is decided. Then the actual training begins, which lasts around 10 to 15-20 minutes, depending on the infant's or child acceptance. who basically decides how long he can stand or how long his interest for the shown scene is maintained. Infants are primarily stimulated laying down on the floor in ventral decubitus position with support on the forearms, and this way they can improve the head control, and then we target the rolling over and the crawling. After we strengthened the extensor muscles of the back, through this movement, the patient are starting the sitting posture. In case of the patients which start from all on four limbs posture, the motion engrams for going on all four limbs are strengthened, as the infant can practice this movement with joy by chasing moles or birds or other elements from the created scenes of the system. And the infants start making moves gladly by catching flowers or picking up leaves or keeping the goal. And the length of the session depends, as we said before, on the child. Although, sorry, most of them might want to stay more than 15-20 minutes, but our possibilities in terms of space and therapists doesn't allow it. And because of its high acceptance and effects, we have decided basically to purchase the second system, like in less than 1 year after the first was installed. What we could say that now, after 2.5 years, is that the NIRVANA device has allowed us to introduce the functional play in the therapy of children with several pathologies, and this game helps them in sensory stimulation by stimulating the visual, auditive perception, improving the logical area by stimulating the thinking, both pre-operational from a few months to age 2 to 7 years, and sensory motor, increasing the capacity to focus one's attention and determining an intrinsic motivation and improving their imagination. In our experience, we have seen how the NIRVANA therapy develops the emotional intelligence, because we have watched them and saw how the disappointment in the game failure opens another door, the virtual image where they repeat the experience, and after countless attempts, in the end, here comes the victory. In the appearance and disappearance of images, the child has come up to a game rule, let's say. If he respects it, he wins. If not, in this case, he gets to repeat. He has the possibility of repetition. And the physician and physiotherapists and psychologists and ergotherapists that work in our hospital consider that this therapy with the NIRVANA system contributes to the development of the child's personality by increasing social interaction, possibility to play the game with 2 players, and this is oftenly done in the center. They have two children who play and do therapy together, or they can watch from outside, and this is also improving, as we said, the personality and the self-esteem. Also, in the NIRVANA therapy, the curiosity increases, as well as the wish of knowledge. The children ask for new games, they want to see something different, and also the personal experience is enriched after each therapy with the NIRVANA system. As a conclusion, virtual reality with the NIRVANA device is an effective therapeutic method, no matter the age. It offers a playful escape gate in the long-term treatment of neuropsychomotor deficits. Thank you.
Yes, thank you very much, Anca and Dr. Padure, for your beautiful presentation. and for all the contents. And I really thank you also all the participants in the webinar.